Hi everybody, I'm student Dr. Maddie.
And I'm student Dr. Shelby, and we're in our third term at SCU in the DC program. And today we're going to be talking to you about all 12 cranial nerves, giving you a little bit of their functions and how you can exercise them at home. So to start off, we're going to start with cranial nerve number 1, which is your olfactory nerve, which is largely responsible for your sense of smell. So one way to distress this nerve, you can do this with sense or without. You're going to plug one nostril. Maddie's going to do it. I'm going to explain it for this one. She's going to plug one nostril, take a deep breath in, and then you're going to switch. Plug your other nostril and exhale through that nostril. And this is just going to work to de-stress that olfactory nerve, and you can do that a few times. Perfect.
All right, so I'm going to take over and we're going to talk about the cranial nerve 2, the optic nerve. So this nerve is primarily responsible for vision, and it has control over your eyes and your pupils. So a way that you can exercise this muscle is a palming exercise. So what you're going to do, you want to warm up your little hands, and you're just going to place them over your eyes, and you don't want to smush your eyeballs, so you can allow them to still blink freely, but you're just going to keep your hands over your eyes for about 2 minutes, or as long as your patient can handle.
The next exercise we're going to talk about is cranial nerve number 3. Cranial nerve number 3 is your oculomotor nerve, and it plays a function in a lot of eye movements, and it also will help you constrict or dilate your pupils. So one way that we can work on this nerve and exercise it is to look at an object that's far away. So this can be in your house, it can be if you're looking at like a tree outside the window, and you're going to focus on that far away object and then on something near. So for me right now, my finger is gonna be the near object, and something on the other side of the camera is the far. So I'm looking at the far, I'm gonna focus my eyes again on that near. And I'm just gonna keep doing that, making sure that each time the object that I'm focusing on comes into focus.
All right, and we're gonna move into cranial nerve 4. That is our abducens nerve. And this, you can combine abducens and cranial nerve 6, your trochlear nerve, in one exercise here, because they're both responsible for different eye movements. So for cranial nerve number 4, what it does is it is responsible for downward and inward eye movements. And then cranial nerve number 6 is responsible for looking directly out to the side. So for that cranial nerve number 4, you can track something down and in with your eye, and then bring it back to neutral. Down and in, and then back to neutral. And you can repeat that on both eyes as many times as your patient feels comfortable. And then for cranial nerve 6, you'll have them look out directly to the side, and then back to forward. Out to the side, and directly forward. And try to instruct your patient to keep their head neutral and only look with their eyes.
Now we're going to talk about cranial nerve number 5, which is your trigeminal nerve. Cranial nerve number 5 has both a sensory component as well as a motor component. For our exercise video today, we're just going to kind of focus on the sensory component. So all you're going to do is you're going to take your fingertips and you're going to tap on your forehead, which is working the ophthalmic division of trigeminal. Then you want to exercise the maxillary division by just tapping on your cheeks, and finally moving to your jaw just to tap there to work the mandibular division. And you can just kind of continue to move your fingers around, and this is just going to awaken that nerve to get it to start functioning right again.
All right, and I'm going to jump over to cranial nerve 8, which is your vestibulocochlear nerve. This nerve kind of has a role in hearing as well as balance. So we're going to focus on the balance component for this exercise. So what you're going to do, you're going to have a patient and they're just going to balance on one leg. If they're unable to balance on one leg without wobbling, you can have them hold on to something nearby, have a table, a chair, whatever, and they can hold this for as long as you see fit, and then you have them switch legs and again hold that for as long as you see fit.
I'm now going to talk to you about cranial nerves number 7 and number 9. So cranial nerve number 7 is your facial nerve. It has both a sensory and a motor component, and is responsible actually for taste in your tongue, but we're going to focus more on that motor. So we're going to just start simply. You can do different facial expressions. So you can raise your eyebrows is a good one. So just raise your eyebrows and let them fall. Raise and let them relax. You can puff out your cheeks. smile, and you can frown. So you can just do these series of facial expressions just to kind of awaken that nerve as well. Then we're going to talk about cranial nerve number 9. Cranial nerve number 9 is your glossopharyngeal. And that nerve is responsible for taste to the posterior 1/3 of your tongue. And it also has a sensory component in working with your gag reflex and vocal cords. So to just work cranial nerve number 9, we're gonna make a series of ah, e, and o noises. So you can work with your patients to kind of just awaken that nerve just by going ah, e, o. And that's just kind of gonna awaken that glossopharyngeal nerve for you.
All right, so I'm going to talk to you about cranial nerve 10. That is our vagus nerve. Cranial nerve 10 is sort of a motor nerve that works in your throat largely. So it plays a large role in your gag reflex, but it also plays a role in like working the muscles that help produce your voice. So I feel like it's a little more fun to focus on that than to gag our patients. So what you could have your patients do is just sing their favorite song. Shelby, would you like to demonstrate?
I'd love to. Twinkle, twinkle, little star, how I wonder what you are.
Beautiful.
So now let's go ahead and jump into cranial nerve number 11. So cranial nerve number 11 is plays a motor role. It actually innervates your trap muscles, so up here on your shoulders. It also innervates your sternocleidomastoid, which is a neck muscle. So these muscles are both prone to hypertonicity, so a really good way to kind of relax them and also work your spinal accessory nerve is to do some shoulder shrugs for that trap. And then you also can just do some head rolls, which is going to feel really good for both those muscles and is going to make that spinal accessory nerve de-stress just a little bit.
And now we have made it to our final cranial nerve 12. That is our hypoglossal nerve. The hypoglossal nerve plays a large role in tongue movements and tongue strength. Crazy that I had a tongue twister there. So for the tongue movements, we can have our patient just make a series of noises with their tongue. The best one for that would be tongue clicks. So you just have them raise their tongue up to the top of their mouth and they can just repeat that as many times as necessary.
So we've talked to you about all 12 cranial nerves, giving you a brief overview of their function. Keep in mind that they do lots more for our body. And we've talked to you a little bit about some exercises. So thank you so much for your time and for listening. And we hope you have a great rest of your day.